global health education at Duke takes students out of the classroom and into the world. These experiences are led by faculty from across the university who inspire and support students along their academic journey.
The faculty at Duke in general, they're just really invested in their students. At the Global Health Institute, I think it's the same thing. They're all very invested in their students, but they take it a step further because they're all super invested in changing, health outcomes around the world, and they really are passionate about what they teach.
And they want us to succeed. They want us to go do great things in global health or wherever it is we go. And secondly, just making you a go-getter, making you really passionate about something to the degree that you want to go out and figure out a way to apply it to your real life.
I've had a ton of access to mentorship and been able to develop really close relationships with professors. They tend to be kind of like quirky, so a little bit different, really engaging, interesting, and energetic. So they've been really fun people to take courses with.
I've never really considered them like classes at Duke. I have to go to my biology lecture, but I get to go to my global health lecture. There are significant components of classes that are lectures, but it's always building up into a project or building up into an activity. You're always working with your class, your team members, and I think that's representative of what global health is.
In 2013, Duke University launched one of the first liberal arts majors in global health. Paired with another major, this degree allows students to carve their own path and pursue what matters most to them. This year, 10 students will be the first to graduate with a degree in global health.
I am a senior double majoring in public policy and global health, as well as getting a chemistry minor. So I chose to major in global health because after taking the intro class, I really found that it combined a lot of my interests really well. So I was able to draw upon my interests in science, policy, economics, cultural anthropology. I mean, it just combined so much, and I found that to be really refreshing because it forced me to think in very complex ways.
I'm majoring in economics and global health. I think it's really important to study global health and something else, coming at global health from the perspective of another discipline. And I really liked the global health major because it allowed me to take a really multidisciplinary approach and to combine my interests in economics and global health. The global health classes, I think, have been useful in opening my eyes to the different topics and problems in global health, so that later on in graduate school, I have more of an idea of what problems there are, what sorts of research questions to ask, and then at that point, I can use the technical skills I've developed from math and other economics classes to answer those questions.
Global health at Duke has really taught me how to be an effective member of a team, taught me how to engage with students, with faculty, and across cultures. It's really taught me a lot about communication and the complexity of health issues around the world.
As part of their education, students translate classroom learning into action through opportunities like Bass Connections and the Student Research Training Program.
What was great about the SRT program has been basically the ability to go to Uganda and apply lessons from the classroom to the field, and then also have a huge amount of responsibility on projects, which leads to, more than any other experience I've had through other summer internships and classes, a lot of personal growth, because you're really forced to adapt to different environments.
Even the research projects that go on here from our faculty have been a really just fascinating way to get involved in global health. I was involved in a Bass Connections project, and it was focused on mitigating interpersonal violence in the Latino community in Durham. It was a lot of fun for me to engage in a way that I hadn't really done before and really help the local Durham community and help out, right in our backyard at Duke.
My fieldwork was in India, and I was working with an NGO that starts self-help groups, which are basically village-level banks. Being able to write a thesis was really incredible, and really did learn a lot from it, and I think it'll help me in the future.
Because it is such an experiential-based program, I think that the experiences that I've had taught me a lot about myself and a lot about responsible service, about the importance of collaboration, the importance of humility, some of these character and personality traits that I had to develop with experience.
My fieldwork has definitely pushed me to see the complexities of global health. I think that you definitely are exposed to it in the classroom, but when you see it on the ground, you realize just how many factors are interacting to lead to health outcomes and lead to the circumstances in which people are living, and just the stories and the depth of understanding that I think students bring back really adds a lot in the classroom.
The possibilities to study global health at Duke are endless. To solve global health challenges, we need well-educated, globally minded leaders to inspire, connect, and transform the world for good.
Duke equips students to lead research, to lead businesses, to lead in the field of medicine and law, but to bring the unique multidisciplinary perspective of global health to whatever type of leadership they choose to engage with. Global health leaders definitely start at Duke.
To learn more about undergraduate global health education, visit globalhealth.duke.edu/undergrad.